Hi guys, I want you to sit back and imagine that you are a 26-year-old and you see your friends getting jobs and getting married. However, you are retiring and moving back in with your parents. In a matter of 6 months, you go from working 80 hours a week as a paralegal to where long conversations will completely drain all your energy. You have difficulty opening a jar and turning the key in the doorknob. The way you talk gives the impression that you could be drugged or slurring your speech from alcohol. You can no longer raise your arms up and down before you start shaking uncontrollably. You lose your sense of balance and coordination. You are losing muscle tone as the months carry on, and taking a shower and being able to dress yourself is a challenge. You are entering the unknown blindly, and you learn to take every day you get while also checking off items on your bucket list. This is an individual who is suffering from ALS. Our group, which consists of Cindella, Alexis, and myself, Carrie, is going to tell you more about this devastating disease. ALS stands for amyotrophic lateral sclerosis. Then you ask yourself, what does amyotrophic lateral sclerosis mean? Well, amyotrophic means that the muscles have lost their nourishment. When this happens, the muscles become smaller and weaker. Lateral means that the disease affects the sides of the spinal cord where the nerves that nourish the muscles are located. Sclerosis is the diseased part of the spinal cord develops hardened or scarred tissue in place of healthy nerves. So I've included a picture here that shows what a nerve cell looks like. So this is one of a normal nerve cell versus one that's abnormal that a patient with ALS would have. So motor neurons are nerve cells that control muscle movement. So neurons normally move cellular materials along these axons to keep nerve cell messages flowing and to maintain the health of the whole nerve cell itself. In an ALS patient, there is a progressive degeneration going on of the motor neurons, leading to cell death. Therefore, ALS is a rare progressive neuromuscular disorder due to loss of motor neurons. ALS attacks the nerve cells in the brain and spinal cord that control voluntary muscle movements like chewing, walking, breathing, swallowing, and talking. When lacking this nervous system stimulation, the muscles soon begin to weaken, twitch, and waste away until individuals can no longer speak, eat, move, or even breathe on their own. The cause of ALS is unknown. It is a terminal disease where patients will succumb to the disease within 2 to 5 years after diagnosis. However, there are a few patients that may survive for more than 10 years. There are two systems for motor control, and this picture shows how the upper motor neurons send messages from the brain to the spinal cord, and then the lower motor neurons send messages from the spinal cord to the muscles, where the muscles contract, allowing for voluntary movement. Over time, ALS causes the motor neurons in the brain and spinal cord to shrink and disappear so that the muscles are no longer receiving the signals to move. Therefore, the muscles get smaller and weaker, as you can see in this picture. Gradually, the muscles no longer work and the body becomes paralyzed. However, ALS patients can still see, hear, smell, and feel touch. The nerves that carry feelings of items being hot or cold, as well as feeling pain and pressure, are not affected. Here we provide you with some background information on ALS. So it was first discovered in 1869 by a French neurologist named Jean-Martin Charcot, and it actually took 70 years for the disease to make headlines. And as you know, ALS is also known as Lou Gehrig's disease because it was named after the famous New York Yankees baseball player Lou Gehrig. He was forced to retire after developing the disease in 1939 and passed away 2 years later at the age of 36. Then we come to Stephen Hawking, who was a British theoretical physicist who was diagnosed at the age of 21 and recently passed away at the age of 76. The pathophysiology is when there is a disruption in the communication pathway between the upper and lower motor neurons, resulting in the breakdown of motor neuron function. When this occurs, the motor neurons die and the muscle fiber that they supply atrophy. The electrical and chemical messages that originate in the brain cannot reach the muscles to activate them, so the brain essentially loses its ability to initiate and control voluntary movement. In this picture, it shows on the left-hand side how the upper and lower motor neurons are communicating quite nicely. You can see how the signals are getting to the muscle and the muscle is contracting. However, on the right-hand side, it shows neurodegeneration occurring and the communication is not getting to the muscles and the muscles begin to atrophy. The signs and symptoms of ALS truly depend upon the location of the affected neuron. Here are some early symptoms of ALS, which include muscle weakness, fatigue, tripping and or dropping things, slurred speech, and muscle cramps and twitching. Here we have it broken down upon locations. So if the upper motor neuron is affected, a patient could experience weakness, hyperreflexia, which is when someone has overactive reflexes like having twitching tendencies, and spasticity, which is when certain muscles are continuously being contracted. Now, if the lower motor neurons are affected, a patient could experience, again, weakness, amyotrophy, which is also atrophy, and then vesiculation, which is muscle twitching. Then if the bulbar muscles are affected, a patient could experience dysphagia, which is difficulty swallowing, and dysarthria, which is slurred speech. Again, there is no known cause for ALS, however, here are some possibilities. So genetic mutations can lead to inherited ALS. Under chemical imbalance, there is a chemical messenger in the brain called glutamate, and ALS patients have higher levels of this glutamate in their brain. Too much glutamate is known to be toxic to some nerve cells. Another possible cause is when the immune system is disorganized and their own body is attacking normal cells, leading to nerve cell death. Lastly, there could be a protein mishandling, which is an accumulation of abnormal proteins within the nerve cell, which would also lead to nerve cell death. So we come to risk factors for ALS. The cause of ALS is unknown in 90 to 95% of cases. The remaining cases are inherited from a parent who carries a mutation in one or more genes. The risk for ALS increases with age, and it's most common between the ages of 40 and 60. There's a 2-to-1 ratio where it's more common in men than women. And studies have shown people with familial ALS and those with non-inherited ALS have similarities in genetic variations, resulting in people being more susceptible to ALS.
Okay, so just as there is no specific cause for ALS, there is also no specific diagnostic tool that a physician can use to determine, okay, this patient has ALS. Essentially, when a patient presents with symptoms, the healthcare provider does a series of tests to rule out other potential diseases. So one of the tests that a physician can do is a physical examination, and this is done by a neurologist, and he looks specifically for muscle weakness, slurred speech or disorientation and disoriented speech patterns, muscle twitching, shrunken or tight rigid muscles or contractures, erratic mood changes, like if there's a uncontrolled outburst of crying or laughter, and a sort of loss of good judgment. So these tests are performed to rule out other diseases that have the same or similar symptoms as ALS. Okay. Blood and urine tests for thyroid disease, lack of vitamin B12 tests, HIV tests, and hepatitis tests. Okay. And with the thyroid disease and vitamin B12, deficiencies, patients tend to present with muscle issues like stiffness, swelling, and with vitamin B12. Patients have like numbness and tingling, and so a physician may want to look into that to rule it out. HIV and hepatitis. These patients generally tend to present with a fatigue that's not alleviated with rest, and so a physician may want to also rule that out. With autoimmune diseases, patients' own bodies affect their normal functioning cells. So a physician may want to look into that to rule that out. And in terms of cancer, there could be a growing mass of some sort that pushes up against the nerve and causes ALS type symptoms because the nerves and the muscles don't communicate well, and that could be something that a physician would also want to rule out as well. Okay, so the EMG or electromyography is one of the most important diagnostic tests used in detecting ALS. And what the EMG does is it measures muscular electric current conduction, and that is how fast muscles conduct electricity and whether they are able to do it effectively or not. While the nerve conduction studies, these measured the ability of the nerves to send signal to the muscles. And with the nerve studies, it's only about 10% of ALS patients that have abnormal nerve conduction studies. So while these are used, they are really not diagnostic. So some other tests that can be used to rule out various types of muscular diseases would be muscle biopsy, for example, and a physician would go in and remove a small piece of muscle tissue and have it tested, and usually they're looking for abnormal cell growth, which could be indicative in cancers, certain types of cancers. Some patients seek second opinions, and this is very big for patients because there's no definitive test for ALS, and many other diseases present with similar symptoms. So many patients just seek second opinions from other specialized physicians, and many times a different physician could do a different workup by using different tests. So it may end up being more conclusive at the end of that session with that physician. Proof of progression would be the repeat testing in 6 or more months to determine whether or not the disease process is, 1, is it reversed? 2, is it the same or has it progressed? And again, as we said before, ALS is a progressive degenerative disease. And though it progresses at different rates in different patients, one thing is clear-cut and across the board is that it does progress. So with worsening or muscle weakness and impaired nerve function, a preliminary diagnosis of ALS may well be confirmed.
Here are some nursing diagnoses that apply to ALS. So how do we care for a patient that has ALS? Well, first and foremost, we want to maintain the airway patency. So you would keep suction readily available just in case they do happen to aspirate. You want to encourage the use of the incentive spirometer and breathing techniques, anything that you can do to help to maintain the strength of the muscles used to breathe. Even chest physiotherapy is used a lot of times to prevent aspiration. Sometimes they might even switch to a complete softer liquid diet. You want to discuss the risk with the family member, caregiver, and the patient. That they need to sit up straight when they eat, don't lie down after eating, just basic aspiration precautions. Also to eat small frequent meals so they're not eating large portions all at once. You also want to change their positioning frequently because a lot of these people are wheelchair and bed bound, and they're not moving around. So that puts them at risk for skin breakdown. And you also want to assess their skin frequently. To promote an adequate nutritional diet, you want to make sure that they're increasing their fiber because constipation is such a big issue. You might need to administer stool softeners if necessary. And as always, 2 to 3 liters a day. They still need their fluids, whether that be orally, IV, however they get their fluids and their intake. Actually, a lot of times they end up having to get some type of G-tube, PEG tube, enteral feeding because of the dysphagia. You also want to promote activity and exercise. Even though their muscles are weak and they can't move, you want to help them with passive range of motion just to maintain that muscle tone and strength. And you always want to consult with physical therapy as far as their abilities go. So while the symptoms of ALS can vary from patient to patient, for the most part, they all have some type of difficulty with speech. You want to help them to explore a variety of communication methods. There's written, sounds, images. There's many methods to communicate, and you want to help them to explore that. You can also consult with speech pathology when it comes to their speaking. There's something newer called a brain-computer interface, which is a direct communication pathway between the brain and an external device. So this allows the patient to communicate without talking. It's very expensive. It's what Stephen Hawking used for many years. And even though it's expensive, you should always just mention it. And I mean, it is out there. It's a resource. You also want to encourage communication of fears and concerns. So this goes along with assessing their support system, their grieving, their coping, how they're handling their diagnosis. You want to discuss their body image, encourage them to set realistic goals, and just have that open communication so that if you need to refer them to counseling or some other type of psychosocial support, you can.
Okay, medical therapies. So first we have riluzole. Riluzole is a neuroprotective agent that blocks glutamatergic neurotransmissions. And essentially, it delays the neurodegeneration that occurs in the central nervous system and slows the progression towards paralysis. Okay? Radicava. Radicava is a brand new drug. It's FDA approved, and it shows signs of slowing the decline of physical function. It has not, however, been fully tested for renal, hepatic, pediatric, and pregnancy side effects. So a patient may want to take that into consideration when deciding whether or not they should use that drug. Sedative drugs are also available, like diazepam, for patients with ALS, and they are used to treat muscle spasm and anxiety, especially anxiety associated with a syndrome called locked-in syndrome. And what that is that patients are fully aware, they can see, smell, hear, taste. But if, for instance, they would be in a situation where they need to physically remove themselves from danger, they would not be able to. So that kind of anxiety can be treated with sedative drugs. Okay, so I should say here, while medications are available, none of them are curative. ALS is a chronic progressive degenerative disease to which there is no cure. Okay, so this brings us to the end of our ALS presentation. Thanks for watching.